Welcome, take a deep breath. Now imagine that breath is harder to come by. That's the daily reality for millions living with chronic obstructive pulmonary disease, or COPD. In this video we'll explore what COPD is, its causes, how it affects your body, and what can be done to manage it. So, what causes this debilitating disease? The most common culprit is long-term exposure to irritants, primarily cigarette smoke. But it's not just smokers who are at risk. Exposure to secondhand smoke, air pollution, occupational dusts and chemicals, and even frequent childhood respiratory infections can all contribute to the development of COPD. Rarely, a genetic condition called alpha-1 antitrypsin deficiency can also lead to COPD, even in people who have never smoked. To understand COPD, picture your lungs as a vast network of tiny air sacs called alveoli, responsible for exchanging oxygen and carbon dioxide. In COPD, damage occurs in two main ways. Firstly, there's emphysema, where the walls between these air sacs are destroyed, reducing the surface area available for gas exchange. Secondly, there's chronic bronchitis, characterized by inflammation and excessive mucus production in the airways, further obstructing airflow. These changes trap air in the lungs, making it difficult to exhale fully, leading to shortness of breath and a persistent cough. COPD is a widespread global health problem. It's estimated that millions of people worldwide suffer from COPD, and many remain undiagnosed. The prevalence of COPD increases with age and is higher in individuals with a history of smoking. While it affects both men and women, in recent years, we've seen an increase in COPD diagnoses in women, possibly due to changing smoking patterns. The signs and symptoms of COPD often develop gradually over time. The most common symptoms include a chronic cough, often producing mucus, shortness of breath, especially during physical activity, wheezing, chest tightness, and frequent respiratory infections. As the disease progresses, individuals may experience fatigue, weight loss, and swelling in the ankles, feet, or legs. It's important to note that not everyone with these symptoms has COPD, but it's crucial to consult a healthcare professional for proper evaluation. Diagnosing COPD typically involves a combination of medical history, physical examination, and lung function tests. The most important test is spirometry, which measures how much air you can inhale and exhale, and how quickly you can exhale it. This helps determine if there is airflow obstruction, a hallmark of COPD. Other tests, such as chest rays or CT scans, may be used to rule out other conditions or assess the severity of lung damage. Arterial blood gas analysis can measure the oxygen and carbon dioxide levels in your blood, providing further insights into lung function. COPD encompasses conditions like emphysema and chronic bronchitis. Although asthma shares symptoms, it differs in terms of the inflammation's nature and reversibility. Bronchiectasis, another lung condition, is characterized by enlarged airways and excess mucus. Accurate diagnosis and treatment planning are crucial for managing these distinct respiratory diseases effectively. While there is no cure for COPD, there are numerous treatments available to manage symptoms and improve quality of life. These include bronchodilators, which relax the muscles around the airways, making it easier to breathe, inhaled corticosteroids, which reduce inflammation in the airways, and pulmonary rehabilitation, a program that includes exercise education and support to help individuals manage their COPD. Supplemental oxygen therapy may be needed in advanced cases to increase blood oxygen levels. In some severe cases, surgery, such as lung volume reduction surgery or lung transplantation, may be considered. The most effective way to prevent COPD is to avoid or quit smoking. If you smoke, quitting is the single best thing you can do for your lungs and your overall health. Avoid exposure to secondhand smoke, air pollution, and occupational irritants. Get vaccinated against influenza and pneumonia to reduce the risk of respiratory infections. And finally, if you have a family history of alpha-1 antitrypsin deficiency, consider getting tested. The prognosis for COPD varies depending on the severity of the disease and individual factors. While COPD is a chronic and progressive condition, with proper management, many individuals can live active and fulfilling lives. Researchers are actively working to develop new and more effective treatments for COPD, including targeted therapies that address the underlying causes of the disease. Recent advances include improved bronchodilators, new delivery devices, and research into regenerative medicine approaches to repair damaged lung tissue. The future holds promise for better outcomes for individuals living with COPD.